I'm joined by colleagues from the National Centre and colleagues and friends from around the country who are going to present to us today. If you can introduce yourselves in the chat, just your name, role and organisation, if you'd like to, that would be great. We have got we're currently up to 82, which is great. We're going to get started fairly quickly because we know people are sort of strapped for time. So yeah, if you introduce yourself in the chat, who you are, your role and organisation, that would be great. We're in webinar mode, which means that the microphones and cameras are switched off for attendees, but your initials will still show. So we can still see that there are people in the room. We're not just talking into a void, which is always nice to feel when we're in these sessions. We will be recording the session for those who aren't able to make it, so that you'll be able to watch it over again, and we will be uploading it to our YouTube channel, and it also will be made available online after the session. If you've got any technical problems or any problems during the webinar, please just pop them in the chat. Alexis, my colleague, is providing crucial support to me today. We'll be monitoring the chat. So if you've got any problems, do pop those in there. We hopefully will have time for some questions at the end of all three presentations. And if you could put your questions in the Q&A section of the Teams meeting, please, just so that we can pull those out easily and separate them from the general chat. Okay, so I think we'll get started. We've got three presentations today. We hope to have time, as I said, questions at the end of all three. Our theme for today's session is creative health and the 10-year plan for the NHS. Now, I think we're all familiar, hopefully, with the three shifts in the plan: the shift from treatment to prevention, from hospital to home, and or hospital to community, and analogue to digital. Which provide a really sympathetic context for the development of creative health within health and care systems. And there are also themes which run through the plan, which may not be articulated as clearly as those three shifts, but the importance of addressing health inequalities absolutely, just runs right through the plan. A focus on mental health, and the need to involve people in the design and delivery of services to bring the voice of people with lived experience into the transformation of the NHS, and an emphasis on work at neighbourhood and at sort of hyper-local level. And so we'll be illustrating those themes in our presentations today. We're expecting a couple more people, but sadly we've got illness, but our two presenters who are going to present with their co-presenters will be picking up that mantle and running the whole presentation themselves. So I'm going to hand over without further ado to our first presentation, which is from Cornwall, which is actually where I'm based. So I'm particularly pleased to showcase work from the area in which I live. And we've got Julie Pollard here, who's going to talk to us about the creative health in the Community Health and Wellbeing Workers Programme, which was mentioned in the 10-year plan. Julie is the operational team manager for the Community Health and Wellbeing Service. So, and she's flying solo today, her colleague's sick, but I'll hand over now to Julie, and I'll get the slides up.
Lovely, Jane. Thank you so much. And it's a privilege to be invited to talk to you all today. As Jane said, I will be flying solo, as it were. So when we get to the bits and pieces that my colleague Mel from one of our charitable partners, Chaos, was going to elaborate on, I will try to do it justice and give you all that detail. So moving on to a very brief overview. Next slide, please, Jane. Thank you. The Community Health and Wellbeing Worker model is a preventative model with place-based workers in the community, working as those community workers as part of a team around the resident. So it's about being the eyes and ears of the community, but being as integrated with services and being that connection between primary care, for example, and other services and the residents and families. So it comes from Brazil, the family health strategy model there from the 1990s. And then it was adopted in Cornwall, having been trialled in Westminster 5 years ago, almost now, and we're in our 3rd year here in Cornwall. And we have the largest team of 60 community health and wellbeing workers. That's about 41 full-time equivalents. We have 12 partners, all charitable partners apart from one primary care network in St Austell. So we've been able to expand from 5 partners and 10 community health workers in the first year. So we're now county-wide. I'll show you a map of that in a moment. And we're in 9 integrated neighbourhood team areas out of 16. One of the beauties of this role, there are many, is having something called our enablement fund, which allows us to make small purchases for our residents. So talking about creative health and health creation, which is, you know, what this is all about, really. We're able to spend small amounts of money to improve that health creation for people. So, for example, you know, a clothes error for someone who was walking into their back garden to hang out the clothes, but they had to get steps to do it, and they fell over and broke their hip. So by installing a proper clothes area on the level right outside the back door, we were able to have a level area for them to walk to and reduce any sort of health and safety risk there. Someone else who was missing being able to be outside and do some potting of seeds and plants, because again they had steps in their garden. We were able to buy a small table and chairs, put it right outside their back door, buy them some seeds and some pots, and again they did all of that in a creative way, but it was health creation for them, with being outside and being connected and doing something that they really enjoyed doing. Another gentleman wasn't connected with his family because of his hearing was deteriorating. He couldn't hear television, he couldn't hear the telephone, couldn't speak to his family who were hundreds of miles away. And interestingly, what he needed was his ears syringed. And that cost £65. And we're working with the top 10% most deprived communities here, and he didn't have £65. So we were able to get that amount of money from the enablement fund and get that done for him. So the enablement fund is fantastic, and you know, helps us to make a start to improve things with individuals and families. The community workers set up community and activity groups. So again, this is hopefully improving social isolation, looking at things that they're interested in, bringing residents, bringing people together. So we've got cup of care groups, craft groups, book clubs, men's breakfast club, ladies breakfast clubs, bereavement groups that the community workers have set up, and they go along and support those. And in some cases, we then find that as time goes on and people are more confident, then we've got volunteers that will run some of those groups. So bit of a legacy going on there, which is fantastic. I've mentioned the micro areas. So this is very hyper local work within that top 10% most deprived areas. So each community worker has a set of streets, so like a family of houses or a family of streets that they look after. And as Jayne's already alluded to, the Community Health and Wellbeing Worker Programme was mentioned as good practice on page 33 in the 10-year plan. So, you know, we look at this service as health creation and creative health with some of the things that we're doing, and supporting a huge range of concerns. And as I say, integration within their local communities is really, really important, and that's developing. That's just a quick map of all the areas where we're spread at the moment. We started in Central, we're now in North and East and West Cornwall as well. Moving on to some of the things that Mel's going to tell you about today, and again this fits in beautifully with the 10-year plan, sickness to prevention, for example. So we visit our residents once they've engaged with us. There's quite a lot of pre-engagement work, but we visit them on a monthly basis. We then will establish regular drop-ins in our communities for residents to come into, or we can help to get them there. It does reduce social isolation, it improves connection, and it's that hobbies and skills share as well. And you know, that's one of Mel's sort of areas of expertise. Working for Chaos, they do offer a lot of creative activities, and this is obviously improving confidence, communication, friendships, and building really, as people, you know, get to know each other more, communities talking a bit more with each other. You know, it's not rocket science, this, but it is giving people the time and the opportunity and the place, and a little bit of reassurance when the community worker can spend some time to help them get to places, handhold and sort some things out. It's motivating, empowering, as we've listed there, and a whole host of activities that you know, I sort of mentioned it earlier on, but you know, some people have put their, you know, the watercolour set in the residents' homes, so they're unable to get out. Some patients and residents, as we know, are housebound, so you know, being able to purchase something like that and going along and spending some time with them, doing a bit of watercolour, you know. I think another worker said to me that they got someone a bingo set and set that up, and then once a month when they go to do their visit, they have a couple of games of bingo. You know, it's and whilst all that's going on, you've got all the conversation as well of finding out how they are, what matters to you, how are you doing, and so on. So there's a whole host of activities there. And then moving on to a couple of case studies from our community workers in the Truro area. So the lady on the right in the picture is Dawn, and she's in her late 40s. She's married and she's a carer for her husband who has long-term health conditions. She suffers with fibromyalgia herself. She's under our local GP team, under the mental health team. She's had suicidal thoughts. She has obviously given permission for us to give you that detail today, I should say. And she also started to hoard, and lives in social housing. And the community worker has been working with them for 2 years now. We've also obtained some white goods for her through the personal health budget within the system. So that's just to give you a snapshot of Dawn. And then this is some of the responses to, recently she said that rather than just coming along to this group, that she would like to run the group herself. And this is what she was doing here. So that was some of the responses. that she received from the people attending the group. And then her statement really at the end, I think sums it up to say, you know, that she's been given the confidence, she's skill sharing with others. She never thought that she would be getting out and doing this sort of thing, and loving that opportunity. And she's obviously asked to do more, which she's going to be doing with our local residents herself. So that's you know, creative health, but also health creation for her as an individual, and just sums it up beautifully, I think. And then the next slide is of a gentleman who was there, and that is Gwyl. And then on the right are our three community health and wellbeing workers, including Mel, who's also managing the team. Yeah, these are the responses from him, from actually joining in and doing this. And again, I think you can just see a snapshot at, you know, he loves doing it, looks forward to it. It's improving his health and doing something creative. So that's a real whistle-stop tour of the programme, where it came from and what we're doing. And there's just a lovely little cartoon there from Kipper Williams, who I should give credit to. The community health and wellbeing workers spend a lot of time out, basically walking their streets, getting seen, getting known, and they need to knock on doors, and it might take 10 or 11 attempts to get someone to actually engage with us. But yeah, once they do, they seem to really enjoy and welcome that support, not just with all the creative things that I've mentioned, but also we support them with a lot of other issues like housing, finance, mental health, etc., and connect them with the relevant services. So yeah, I think that probably is enough from me. Hopefully I haven't taken up too much time, Jayne. Thank you.
That's perfect, Julie. No, the timing was perfect. Thank you so much. It's such a great initiative, and it's really good to see that within the range of support that you're offering, that there's room in there to offer these sort of creative health opportunities and creative opportunities, and just how empowering those can be. I should also mention to people here that the Cornwall Community Health and Wellbeing Workers scheme is up for a national award, I think, shortlisted for a national award. So you'll be keeping fingers crossed for that in November. If you've got questions for Julie, if you can pop them in the Q&A, and we'll pick those up at the end. And if we don't have time at the end to follow all those up, we will try and get back to you afterwards. Great, thanks Julie, kicking us off with that. So we're now going to move up country, as we say down here, to the Black Country, and I'm delighted to introduce Dr. Ananta Dave, Medical Director at the Black Country Integrated Care Board, who'll speak to us about creative health and health inequalities. And I'm just going to start sharing.
Thank you so much, Jayne. Good afternoon, everyone. Delighted to be part of this event, and very inspiring to hear Julie about the work going on in Cornwall. If there are any people from the Black Country or indeed the Midlands, a shout out to them. And mine is going to be a personal reflection and talk about some of the initiatives that we are trying to do on a small scale in the Black Country. So as the title says, I'm a psychiatrist by background. I work with children and young people, especially those with neurodiverse conditions like ADHD and autism. But in my CMO role in the Black Country ICB, I work with a range of services, mental health services, but also primary care, GP services, and hospital services. So these are my insights based on that system overview. So before I go into the specifics of what I wanted to share, I mean, I thought I would talk about the role that creative health can play, or creativity can play, in mental health and addressing health inequalities. And I'll share my thoughts in a minute. But regarding the NHS 10-year plan, as we know, mental health does get some mention in the plan, but my plea to everyone, I suppose, is that whatever field you're considering, whatever area of healthcare or social care, or whichever part of the body, whichever disorders you're considering as part of initiatives in the NHS 10-year plan, the mental health component of it needs to be thought of as a core component of the work, because I think this is an opportunity for us to start thinking more holistically about the person in their entirety and as a whole, rather than focusing on one aspect alone. And that's the great opportunity I think we have when we move care into the community, closer to home and away from institutions. So this is just a general message. And I say this not only as a clinician, as a doctor who has, got over 25 years experience, but as somebody who has suffered from mental health problems myself, recovered and come back to work. And I think it's really crucial that we try and end the stigma as well around seeking help for mental health conditions. So as a clinician, as a person who has used services in the NHS, both for physical and mental health conditions, as a volunteer and trustee of a mental health charity, and as a citizen, and a wife, mother, and daughter, I just want to say, please do keep this in mind. So my insights, I suppose, are a reflection of all the various roles I hold. I wanted to say that in the Black country, in a small way, we've started exploring what creative arts can do to ensure more help for people in the community while they are trying to access services. So these could be people who are currently well, but who are going in, say, for a screening. These could be people who are approaching their GP surgeries, or indeed any specialist clinic or setting or hospital in the Black country. So there are two things that I wanted to touch upon that we'll be talking about before I go to the next slide. So the first initiative is called Black Country Digital First. And I don't know whether people who are familiar with that part of the country have heard of this, but this is essentially an initiative started by Black Country Creative Spaces, and it's a project which allows creative arts to be taken into the community using a combination of analog, face-to-face, and digital means. And the idea is that by having interactive spaces within healthcare settings where digital means can be used to share creative arts. In my case, poetry. I'm a poet. We are hoping that we can alleviate some of the distress that people have when they are going into healthcare settings, but also help people understand their experiences, share it with one another, and create that channel of communication. So that's Black Country Digital First, and we were able to be selected for this when we put in our entry talking about the use of poetry and visual arts for this project. The other thing that I wanted to mention, people might be familiar with it from other parts of the country, something called Poetry Pharmacy. And I think there are a few shops in the country. Essentially, the idea at the moment is about going into a shop, a setting which is away from healthcare institutions, which is not a pharmacy at the moment, but it is about using creative arts like books and poetry to help people understand the condition. So there are actually bottles with little pills, but instead of a chemical substance, they have poetry in them, little papers with poetry written on them, which are part of these bottles. And people can go there, spend some time, sit together, browse through a variety of books and, other creative content, and, get this prescription, which is in the form of a bottle. But we are hoping that we can take it in a non-stigmatizing way into healthcare settings as well. So these are two initiatives I thought I'd mention briefly before I share my views with you about how we can use creative health in the addressing of health inequalities. Now, although I work clinically in the mental health arena, this could be applicable across any setting. So the first thing, as I've said, which is quite important to me, is about enabling expression of the whole self and holistic health. So when we use creative means vicariously, by not focusing just on the condition, we end up looking at the human element of it, the emotional context, the emotional relationship between the person who is seeking help or an answer to their distress and the person who might be providing it. So this human connection is really vital, and sometimes it can get lost in the kind of technology and the developments we have today. So I think creative arts help in understanding the whole person and understanding the holistic nature of health and creating that emotional connection. The second thing I've realized over the years, and I'm sure it's, it resonates with all of you, is when we use creative ways and culturally sensitive creative ways of understanding other people's experiences and, trying to understand their distress or their hopes and fears, where they come from, we make it easier for people from to hear those whose voices have traditionally been marginalized, who might not feel comfortable coming forward using traditional means or usual means of seeking healthcare. But when we make it into something that appeals to them, that they can actually identify with, or they themselves want to share, all the creative people in the community, it helps them seek help and breaks down some of those barriers. So I think it's really critical to use creative arts to enable marginalized voices to come forward. And the Black country is a very diverse and a very thriving creative place with so many voices which I feel are not heard. And in a very small way, I can understand what they go through, because when I came first to this country as a migrant, many years ago, I felt I had all these labels as foreigner, person of color, not from our place, different accent, as a woman of color, there were barriers. Now I'm in a position of privilege, and I want to use my voice to break down those barriers for people who are in the community who want to seek help. So I think nurturing, yes, absolutely, nurturing the whole self and celebrating all the components of me. And it's taken me a while to become a proud British Indian, celebrate both aspects of my identity, not having to apologize, for one part of my identity for the other to flourish, to not have to submerge my Indianness to be British, and to, combine both. And that's the same for people. They want to be seen as more than their condition, more than their background heritage. They want to be seen as complete selves and then accepted. And this is an important part of creative health. If you could go back to the slide where I was talking about the ways in which creative health can help us, please. Yes. So, and the next one is about, I've already mentioned it, but it's about respecting cultural sensitivity. Now, creative arts give us a mechanism to do that, to ensure that we are able to explore the fullness and richness. I'm mainly write in English, I read in English, I think in English, but I was born speaking another language. So sometimes I do go back to that, to the language that I spoke for the first 5 years of my life, which was Telugu. It's a language in India. And I speak some other languages, from the country of India. But there are so many people, I'm sure in this audience, in the place where I work, where people think and write and share in different languages. And how do we capture that? And if we don't capture that, and if we don't respect that cultural richness, how are we ensuring that we are breaking down those barriers and addressing those health inequalities? And then I move on to the point about by removing focus from ableism, achievement, and privilege, and by focusing on the strengths of people, the creative strengths in this case, we enable people to open up and flourish. We enable people to say, you don't have to have a title, a particular profession, you don't have to live in a particular place, be of a particular color, have a particular accent or class in order to be heard, in order to receive the help you need. And creative arts can do that. And when I share my poetry with others, not as a clinician, but as a person who's had certain experiences or my insights of working in healthcare, what's happened during COVID, it immediately resonates. And I didn't realize it, but some of my colleagues started sharing my poetry with patients whom they see. And it resonated with the patients. And that's what I try and do now. Not even if I don't share directly, I've realized that this is a bridge between me and the patient, between the person. So this can be an incredible bridge between those without privilege and those with privilege. And the last point I want to make, I suppose, is about creative arts being a way of encouraging through sharing, through enjoyment, and through celebrating something. So it doesn't have to be all dull and dark and dour. Of course, we need to be realistic, but we also need to enjoy what we share and celebrate one another, and poetry or any other creative art can help us do that. Now, I don't know how much time I have, but the next few slides are very short sections of my poem, and Jayne, please do stop me if I need to stop. But my first poem is, this is one of the poems in the book that I published called An Agony of Hope. That's the name of the book. And this is one of the poems in my book. And it's a palette of light and shade. And I just wanted to give a flavor of what I mean by sharing our entire, by celebrating our entire self, understanding our entire selves, and being able to share it. So this is the journey that I went through while I tried to bring together the various elements of my identity. And I asked myself, especially in view of the conversation, the tone of the conversation in the country nowadays, I asked myself, am I the color of my skin, defined by my birth motherland, anointed by my adopted motherland, or in no man's land? So these are some of the thoughts that went through my mind, and the full poem is available in the book. Next slide, please. And this is about, the mental health stigma that it's very prevalent in the community still. And as I said, I say this as a psychiatrist and as a person who's had a mental illness. And this is a snapshot of the poem. It is all in the mind. The malaise without a name has made him its home. It is all in your mind, they say. Your body is fine. Then I don't know whether there are other slides. His body, with a mind of its own, hoards up its secrets and threatens to consume him, I think, in the next slides, but continues to baffle them and consume him. So this is about the way people are viewed at when they are told they have functional problems, or, when you can't find anything in their scan or X-ray or whatever. It's minimized, it's diminished. And again, I'm challenging that stigma. And the last poem is about celebrating, celebrating nature, the beauty of nature. And this gives me a lot of solace at the end of the day when I try and take a walk in the evenings. I know it's becoming more difficult now with the daylight, finishing sooner. But this is about the remnants of the season. It signifies autumn. And I say the sun bows with panache on the season stage. Its summary bill of play as the lead actor draws to a close. Its self-care schedule has begun. And it's about celebrating nature and what it can offer us and what is available to all of us. I think that might be the end of my slides. If you can just go to the next one, please. Yes, this is just to say thank you for allowing me to share my thoughts. That's my book, and all the proceeds go to a charity called Doctors in Distress. If people are interested, please have a look at it. And thank you for this opportunity.
Thank you so much, Ananta. So inspiring to hear from you as always, and I can highly recommend the book. It really, some really very beautiful, inspiring and thoughtful poems in there. Apologies for the technical problems in there. These webinars don't like me for some reason, and I get kicked out of Teams. People are telling me all sorts of things I can see afterwards that they can't see the slides, and I can't see anything because the whole screen freezes and I can't even switch off. So many apologies for that, and thank you so much, Alexis, for stepping in there and picking up and sharing those slides. But yeah, thank you, Ananta. Lots to think about there, both in terms of like the 10-year plan, but as you say, about us as people. And the 10-year plan, one of the things I think in it is that focus on this is about people. There's all sorts of stuff in there about reorganizations and structures and how we do things, but actually ultimately it's about how we care for people. Thank you. So finally, Alexis, are you okay to continue to share the slides? Because I'm a little bit worried about taking over and being frozen.
Yeah, that's
again.
Fine, Jayne.
Thank
I'll just
you.
spotlight Melody.
Apologies. So finally, we're heading up to North East London to hear about a burgeoning partnership between the North East London Integrated Care Board and Cardboard Citizens, and how a sort of creative approach, bringing in the voices of people with lived experience, can inform strategy and service development. Melanie Dhinda-Rees is Senior Officer for Health Improvement and Inclusion at the ICB. She also is flying unexpectedly solo today, as her colleague Jessie Wild from Cardboard Citizens is poorly and unable to be with us. But over to you, Melody.
Thank you, Jayne, and thank you for having me. Some really interesting and insightful presentations so far. So yeah, really great event. So as Jayne has said, I am flying solo, so I'm hoping that this will still be as exciting as it was supposed to be, but I'll try my best. So I'm here to talk to you about how we work with Cardboard Citizens, a kind of performing art organisation, to bring the voice of lived experience into the development of a North East London homeless health strategy through creativity. So just some background. So I think this is no surprise to anyone, but homelessness is on the rise, and with it are the kind of associated negative health outcomes that come with being homeless. And there was a real call from our system partners that we needed a homeless health strategy that kind of gave the system some focus on some areas that we needed to kind of address and see some real traction on. Particularly when it comes to the health inequalities or the healthcare inequalities experienced by people who are homeless. And I think also we recognise that as the NHS, we are very good at creating strategies. We're very good at like developing services and implementing these, but there's not always kind of that voice of lived experience that kind of guides this work. And oftentimes as well, we do hear from people, particularly in our engagement actually with people who are experiencing homelessness, that the services are not person-centered and they don't meet their needs. So we were really keen and I'm really committed to having the voice of lived experience embedded throughout the development and the implementation of the strategy. And also we have within our team, Connie, who's a creative health associate, who has really kind of shown the positive impact of creative health approaches in addressing health inequalities, for fostering social connection and empowerment and well-being. So we're really keen to kind of bring all those elements together in the development of our homeless health strategy. So we worked with Cardboard Citizens throughout the process. And as I said, Cardboard Citizens are a theatre performing arts organisation that give voice to those who experience social disadvantage, particularly people who experience poverty and homelessness. So we've been on a real journey with Cardboard Citizens. We have been working with them before we actually developed the strategy, as well as kind of through the development of the strategy, having the members give the okay to the priorities in the strategy. And then now also we're thinking about how we continue that journey, working with them in the implementation of the strategy. So in May of 2024, we held a homeless health symposium, and this was kind of the start of our engagement with. So I can't see the slides for some reason. So if you could go to the second slide, just so that you can see the pictures from the symposium. But yeah, so we held a symposium, and this was a first round of engagement with our system partners and stakeholders to kind of test out what our priorities would be. Oh, there they are. I can see them now. So the second slide, please. Thank you. Yes, so test out our kind of areas of focus. And again, we were keen to have lived experience as well as creativity throughout the process, and Cardboard Citizens were obviously the perfect partner because of their kind of performing arts and the voice of lived experience of people who've experienced social disadvantage, etc. So we approached Cardboard Citizens and we asked for their members to kind of perform some kind of monologues and spoken word and poems focusing on homelessness, and 3 of their members performed really powerful pieces. When we have NHS events, they're usually quite dry and quite sterile. However, this really breathed some life into the topic area, and it was all that people talked about actually after the event. It really left a mark on people. There was a lot of positive feedback, and also, so we had the performances, but we also had the citizens sitting around discussion tables and feeding into the priorities as they saw things from their point of view. So this was a really powerful way of bringing kind of the creative health and that voice of lived experience into the development of our strategy. We then had a workshop that was led by Cardboard Citizens, and this was to kind of test out priorities. So we did a lot of engagement with the system, and we kind of had our 5 areas that we thought, okay, these are the areas that we're going to focus on. And we were really keen to take that back to the citizens to test them out, to see if they would give those the okay, as well as kind of understanding what implementing the strategy would look like practically. So we had a session that was facilitated by our theatre director, Debbie Hannon, who brought together NHS staff, so my team and some colleagues from our primary care team, as well as Cardboard Citizens members with lived experience, and there was an equal split as well. So I think there was 6 of us from the NHS and 6 of us from Cardboard Citizens. And this session was really to kind of explore as well experiences in accessing healthcare, and it really inspired conversations around how to engage greater inclusion and understanding around people's experiences with homelessness. So there were some icebreakers that were quite, in all honesty, very uncomfortable for people in the NHS, because we're used to kind of very formal, formal meetings, but we had to do some dancing, and some very creative. There's some very creative elements to the workshop, with some kind of improvisation based warm-ups as well, and a lot of exercises. If you can go to the next slide, you'll see some of the exercises that we had on the day. So kind of creating a character who kind of speaks about their experiences in accessing healthcare, and what good looks like. So it was a really, really useful and insightful session. It encouraged kind of empathy, and also really rich conversations between us as the NHS and members of Cardboard Citizens. And I think also it was a real leveler. Like, there was a lot of laughing. It was a very relaxed environment. But also I think as the NHS, we, when it comes to engaging with people who use our services, we kind of are comfortable doing it how we want to do it, but actually no, this made us very uncomfortable, which is a good thing, because we went into a different environment where the people that received the services were comfortable themselves, and I think we should be doing more of that. So it was a really, really lovely session, a lot of laughter, as I said, and also a lot of insights around what healthcare services should look like for people experiencing homelessness. And also, as I said, we were really keen within this session to get kind of the nod of approval from Cardboard Citizen members, and they were able to give us the nod of approval that they were in support of the strategy and the priorities within the strategy. Then we were able to take that to our board, and then it was signed off as the first homeless health strategy in the country. So really, really great. And then, so now that we've got the strategy, we're now working towards kind of how we continue our relationship with Cardboard Citizens and how we continue working with them. Obviously, with the changes within the ICB, it's kind of made things a little trickier. So implementation hasn't been as quick as we would have liked it to be. However, we do have some ideas. So, for example, within the strategy, there's a workforce strand. We are hoping that we can work with Cardboard Citizens around training frontline staff around compassionate and trauma-informed care, for example, even like holding creative wellbeing workshops as well for staff, to kind of build empathy, as well as creating films that kind of demonstrate how people who are homeless experience healthcare services, and ensuring that these films are distributed far and wide, so that people can really see what we're talking about when we talk about the barriers that people face in accessing services. Yes, so I think I'll stop there, if that's okay. Hopefully I didn't go on for too long. But any questions, please feel free.
Fantastic. You've all the presenters have kept amazingly to time. You've been fantastic. So that's great. Thank you so much. And I can see from the reactions that we're getting from people listening in the audience that there's a lot there that people are really inspired by and sort of engaged with. So we have got time for some questions, which is great. We've got some in the chat. We'll perhaps take those from the beginning. So we've got some for Julie to start with. Julie, people interested in knowing more about the Community Health and Wellbeing Workers Programme. Questions about, are they trained centrally? How is the programme funded? What is it? You said a bit about that, and you might be able to signpost people to where they can find out more.
How it's funded. Fortunate in Cornwall and Isles of Scilly that we had public health inequalities funding that was linked with the health inequalities funding from the NHS system locally. So that was for the initial pilot. And then the leaders saw the impact of the first year, and that's how we were able to spread with that future continued funding. In many cases, it's up until March 2029, so we were able to get 5 years funding to develop the programme. Is that okay for now, Jayne, or do you want me to?
There was a question about training. How are they? So someone's asked, are they trained centrally, or how does one become a community health and wellbeing worker? What's the training involved in that?
That's okay. Yeah, no, that's fine. Thank you. So I used to run a social prescribing team that developed in Cornwall before it was rolled out by NHS England, and I really looked at the roles when the CHW role came into being, and then adapted that programme alongside some input from the National Association of Primary Care, because they'd started some workers in Westminster before us. So sort of combination of those things, really. So we have quite a comprehensive training programme, including giving workers qualifications, because one of the beauties of doing this job is that the model says you should try to recruit from your community, because people that know their communities and have those connections already and who are already trusted in those communities, you know, make fantastic community workers, and that is true. However, that's not always easy in parts of rural Cornwall. To always, so we have a sort of, if you live within half an hour's drive of your community area and you can prove you know it well, then fantastic. In London, it's more of a sort of half an hour's walk of your community, and some people actually live in the postcoded hyper local areas that have been identified as some community workers live there. So some people have been recruited from, they've been volunteers in their community. So this is, you know, in some cases job creation as well. However, many have come from different backgrounds in the community. So I'm thinking of learning disabilities, adult care in the community. We've had many people from those job roles. We've got a couple of ex-paramedics, a social prescriber, actually, an ex-teacher, a housing advisor, lots of people from lots of different backgrounds. The qualities really are being able to communicate with people, to listen, huge part of the role, and to be trusted to build those long-term relationships, because this programme is a long-term programme. They've been running for over 30 years in Brazil, and they have now, I heard some latest figures from Brazil last week, actually, they've got 400,000 community workers, covering over 75% of the population there. So yeah, so we don't ask for particular certificates or qualifications, but it's the qualities, the compassion, the listening, the communication, able to build trust with people, and knowing your community is quite key.
Great, thank you, Julie. That's really helpful, and we can put a link in to send around afterwards with where people can find out more about the scheme. I think that'd be great.
Yeah, I can do that.
Thanks, Julie. Ananta, question for you in your role as Chief Medical Officer. I think from Justin Varney Bennett, has the Black Country ICB included creative health in its strategy or any other key documents? He's saying this is a sort of often the crack in the door that's needed. How easy or difficult is that, Ananta?
Yeah, Well, I'm not going to say it's very easy. And I know there's Sandeep on the call from the Black Country, so a shout out to Sandeep. But in the people strategy that we have in the Black Country currently, creative health is mentioned. I have to say that, with the recent changes happening with the ICBs reconfiguring, etc., we are now working across Birmingham, Solihull, and the Black Country. So it'll be a bigger patch. But the importance of creative health is recognized in the strategy. What I also know is, Julie, you were talking about social prescribers, and they are an important part of the neighborhood health development that we're having across what we call the places in the Black Country. And there are a variety of creative approaches or access to creative arts that social prescribers provide. So which is there in the neighborhood health development in the Black Country at the moment. So, but the plan is that through our initiatives and efforts that we are going to keep making a case for creative health to be part of whatever new structures and developments happen. And as we all said, the NHS 10-year plan is a good opportunity to do that.
Great, thank you, Ananta. And Melody, a question for you really around the approach that you took with Cardboard Citizens and just understanding how that compares to other community engagement approaches, and also about costs of that. What's the cost of that approach compared to other sort of models? You might not have any of those comparisons. You might not have done that work previously, but perhaps you can say a little bit more about just about why you think it was such a sort of change. It seems to be quite a different way of working for you.
Yes, I mean, my experience is quite limited, but looking at the previous work I've done when it comes to engagement and comparing it to our experience with Cardboard Citizens, I think for me what's really impactful is kind of that like leveling of the NHS and the people who are receiving services. I think that's what's really, really powerful about kind of using the creative element. And it just really kind of allows you to see the issue from a real human perspective as well. Oftentimes we're reading documents and you're quite removed from the human being, but I think this way of doing things really kind of brings that human element, the empathy, and really levels the playing field and allows also the people who we're delivering services to lead and to tell us exactly what it is that they want from services, because at the end of the day these services are for people, they're not for us. So yes, that's what I found quite powerful.
And do you think what do you think is different about your homeless health strategy as a consequence? Is there anything you can point to? You think, actually that was something that we perhaps wouldn't have got from any traditional sort of engagement methods?
So I've just put something in the chat actually around an outcomes framework that we're developing, and we're making sure that we've got like I statements within the outcomes framework that guide our evaluation and that guide us seeing whether this strategy is a success or not. Usually there'll be quite dry KPIs, for example, but we are making sure that we follow that lived experience element really follows through, the I statements are from people who have lived experience, and we are going to measure our successes according to this. And actually, this is the first time I've ever done something like this. As I say, usually we're kind of working towards quite, dry NHS KPIs.
Perhaps that's perhaps a more general question. I think it's come up around how do we measure outcomes and impact of this work? Ananta, yeah.
No, it wasn't the question that not necessarily an answer to your question, but I saw a question in the chat. I think it's from Maria, who asks about the impact of this work, sharing, creative work on outcomes, especially for neurodivergent people, and whether any studies have been carried out. Now, I don't know about studies that have been carried out on neurodivergent people, Maria, but what I do know is I'm the clinical lead for an autism clinic for young people where I work. And what I do know is when the focus shifts away from their, deficiencies or shortcomings, as it were, and their problems, and moves to their areas of interest and their strength. I'm talking about people with autism autism and ADHD, they're extremely creative people in whatever area of endeavor or interest they have. So when the focus is on their strengths and their interests, and we use that as a way of engaging them, I've personally seen that, for example, they've started attending school more, their engagement with health professionals improves, their overall mood improves, their sleep improves. I mean, I've seen things like a less amount of melatonin prescribing needed when people are, engaged through their strengths and seen as people with something to offer rather than somebody who is not fitting in. So I've seen that in my clinic over the years now, and I am sure there are studies about its impact specifically on neurodivergent people, but there is more and more literature emerging about how creative health can help in various stages of people's journey. So right from prevention to those who actually go in for a particular treatment or service, and whatever the condition, whether it's a physical health condition or a mental health condition, that working alongside evidence-based interventions, it can actually make a difference and help with overall recovery and quality of life. So, but I will try and dig out some studies on neurodivergent people. Thank you for the question.
Great, thank you, Ananta. Well, I think we're sort of nearly there, and I know people, it's nice to keep these things to time. We've got a couple of minutes. Is there anything that either Julie or Melody you wanted to add to anything around measuring impact? I think you touched a little bit about yours, Melody. Julie, I think, is Julie still there? Yeah,
I'm still here. We've had a first year study on health and wellbeing improvement from a company called Meaningful Measures. So you will be able to find that report link on our website at Volunteer Cornwall, and that showed a program called Michael, which is measuring your concerns and well-being. So we try and focus in with residents on what matters to you, and then look at two main concerns, which is what the tool is, and then measure it from the start to where they feel they've moved to within a 6-month period. And the first year's results showed a 90% improvement in health and well-being, which was pretty astonishing. That was just with the central team. Now we've spread across the county a lot more. We're awaiting the second year's data. A second report has been commissioned, and that should be out, I'm told, by the end of October. So again, once that's ready, that will be published. The other impact information we're getting really is, and I have to say, hand on heart, it's not always easy to get, is through the GP systems. So, a lot of that depends on recording, coding, information being pulled through, and so on. So where we have a partner who are a primary care network themselves, that's been really much more easy to get some of that information. And so initial findings on that were things like a reduction in emergency department use referrals, and a reduction in GP face-to-face appointments. But we're hoping to have more of that for across the county. But as I say, that's sort of one of our missions for the next few months, really, is to get that impact data, or on the health side of it, obviously. I think, and also in that PCN one, we had improved uptake in cancer screening and bowel screening. So, so that's just to give you a little flavour, but it's not exactly where I want that information to be, because it's quite difficult to sometimes get exactly what we want, if that makes sense.
It absolutely does. I think there'll be many people on this call who'll recognise that, both within the health service and when we're working in partnership. There's a whole lot of issues, aren't there, around that? But thank you for that. We're voluntary sector and we're the lead, and all of that can be tricky, but we'll get there. Brilliant. Well, thank you all. We've reached the end of the webinar. Thank you so much to our speakers today, to Melody, Julie and Ananta. And I hope that, we've got some different perspectives there, but I hope you can see, there's plenty there for you to be thinking about. And I hope it's given some of you inspiration, motivation, questions for taking forward creative health in your systems. We will have a recording of this being made available after the event. Just to mention a couple of things before we finish, we have a newsletter that's specifically targeted at those of you working in health and care sector. So do sign up to it if you haven't already. You can sign up to that. You can get onto our website and we can send out a link to that if you haven't. We've got another webinar in this series on December the 10th at the same time. We haven't finalised the details of that yet, but we will be circulating information around that. So I hope to see some of you there. And I'd also encourage you to take a look at our website if you haven't done recently. Particularly, we've got a new section, a new How page, which has got lots of new content specifically aimed at health and care staff. And also take a look at our Creative Health Toolkit, which also contains examples and guidance to help you sort of progress creative health in your system. Again, we've got some new examples in there. We can send these links out. Afterwards. But thank you all very much for coming along today, and we hope to see you at a future event. And do enjoy the rest of your day, everyone.